Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I was asked to discuss mitochondrial dysfunction, pretty much an aggregate of every single disease that you can imagine on the planet. That's because mitochondria occupy pretty much every single cell in the human body, with the exception of the red blood cell. Its job, of course, is to produce our energy for the life of a cell, ATP. And there are many things that can cause this mitochondrial dysfunction. The sine qua non, of course, is diabetes or cancer. Toxic metals also can. Ionizing radiation, immune system dysregulation, failure due to unregulated inflammation, drugs, senescent cells, too much fatty acid oxidation, vaccines. And even excess of certain nutrients can do that as well. Hereditary factors do play a role. Stress, reactive oxygen species, too much or too little, microcirculation, viruses, pathogens, mycotoxins, yes. Every and all of them can affect, and there is an aggregate. It's not just having one assault to these cells, it's multiple that can reduce the functioning of the mitochondria, including adrenal dysfunction that I didn't mention earlier, and shock and trauma in someone's history. And the autonomic nervous system is also heavily involved in maintaining mitochondrial health. Now, the things to start looking for is increased glucose transfer, increased insulin receptors, anaerobic fermentation, which you could be able to tell through lactic acid and LDH isoenzyme, looking at amino acid fermentation in such as glutamine and glutamate levels, higher glutamate levels. You can look at markers of oxidation like hemoglobin A1C and malondialdehyde, lactic acid, as I mentioned, and even creatine kinase. Now, there's also a new specialized scan where a blood spot of your environment is sent to a lab that introduces your environment to a muscle cell. And they do 12 tests or perform identifying pretty much how the mitochondria is performing at both rest and stressed conditions. And this gives the clinician a very good insight into your patient's mitochondria and where it's lacking in performance. This in turn allows the clinician to address the specific areas of concern with targeted therapies. Yes, be aware of mitochondrial dysfunction. Hopefully this quick primer at least guided you to think of the things that can cause this, but pretty much you should be aware that any disease or any combination of several components can lead to problems with mitochondria's capability. And that capability is not just for producing energy, it also, to remind you, produces 80% of the reaction oxygen species in our body. And yes, we don't need too much because that will attack our tissues. And yes, we do not need too little. There is that happy in the middle situation. That's where we're trying to find out. Mitochondrial dysfunction, more on this to come in the future.